Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. I'm here using my own Emsella chair, and my assistant Desiree is going to throw at me all these questions people have when they do Emsella or use Emsella chair at the office for their pelvic floor dysfunction. So first, this is Emsella. This is the actual monitor that we set the patient, and we have it all set up. So Desiree, should I go ahead and start it?
Yeah.
So I'm just gonna place start. So this is a inaction thing, and so it's already on. Position the patient, press enter, all that stuff. So here we go, and I'm gonna crank this up. So I'm sitting here with the whole bottom of me, not just the anus or the vaginal opening, but that whole surface. So vaginal opening, anus, and that tissue in between is is on the chair. I'm gonna crank this up, and what I'm looking for is a sensation in all of that area at the same time. So here I am feeling it now about. Okay, so now I'm going to position myself. What we want to do is to make sure that the whole area is being addressed. Every time there is a contraction or there's that stimulation, the whole inside feels like is contracted and lifting. That's what it feels like to me. Is that how people describe it to you too, Desiree, do you think?
So that's the most common question is, what does it feel like? What is it supposed to feel like?
So there is no supposed to, because we both know, like, one of the things that happens. So this is, I'm cranking this thing up. Okay, so I think I'm gonna keep it there, not because it causes any pain, but I feel like I'm getting sufficient contraction. Does it feel like muscle stim? No, it doesn't actually, because I can't describe what it feels like, because muscle stim is more of a stimulation like this, and this is more of a doing this and just lift it. Doing that and just lifting inside of me. That's what it feels like. I'm going to crank this up even more to see where we go. So right now I feel like as I cranked it up, I feel like I'm tilted. My pelvis is tilted, so I'm feeling more in the front than the back, and actually on the inner thigh a little bit. So that's when we have to adjust patients, and that's what we do. So I'm just going to sit back a little bit more. I feel like I need to move a little bit to the right. Maybe that was a little too much.
How did you know?
How did I know? Because it wasn't, this is definitely evenly distributed. Because as I moved to the right, I felt like I was feeling it on one side more than the other. So I positioned myself a little bit more, and now I'm there. With every contraction, I feel like that whole surface is being contracted and lifted. So right now, I'm just gonna crank that up still. And this is very good. So one of the things we look at is, are the patient's feet on the ground? Because we want to make sure that the feet are on the ground. And sometimes people actually, so this, you can hear the sound it's making because that's stimulating it differently. It's relaxing, it's stimulating, it's prepping for the few, I think we counted it, a few seconds. And then it starts going through that phase again. There are different parameters that we can set, but that's how it feels. But back to the feet are on the ground. And sometimes people feel it in one leg more than the other, right? Mm-hmm. We've had that issue going on.
Or they feel it going down their leg.
Going down their leg all the way.
Mm-hmm.
Posteriorly. Mm-hmm. So that all depends on what muscle is being activated. or it shouldn't be any of those muscles. So we need to position, that just shows the imbalance. We've done a video on how your adductors, your hip rotators, and your hip stabilizers play a role. So if they're not even, so now it's going up again. So when they're not even, you're gonna not feel the contraction evenly, so people realize it. Now, does this happen every time the patient comes in, or is it typically at the beginning, Desiree?
It can happen every time, but it's usually towards the end of the session, because you're sitting there for 30 minutes, that people either collapse or they do the opposite, trying to hold themselves up, and it throws everything off.
Okay, so do you see how because you need to sit here for 30 minutes. Now we have cushions that we put, and we have a timer that we come in and we check the patient's positioning, because we want to optimize the session to the best advantage for our patient. But as they fail and they get tired and they sit right here. Like right now, as I'm sitting here, I'm lifted up. I'm not sitting on my pelvic floor evenly. As I go up, I definitely feel it on that, and now I'm gonna arch my back. And once again, it's not even distribution, which makes sense. So you need to be seated on your seat mode and basically checked periodically to do that. Any other questions that people have?
We've done other videos, but I don't think you said it specifically in this one. What does it do?
So what this machine does, it actually produces 400 Kegels a minute. So imagine 400 times 28 minutes, 30 minutes, 28 minutes is how many Kegels you get with every session. Why is that important? Is that only for incontinence? Well, the machine is FDA approved for incontinence by producing Kegel. So I use the machine for every time I see Kegel, pelvic floor dysfunction that exhibits signs of weakness in the pelvic floor. So that becomes in conjunction with whatever else we're doing. Not everyone who receives this has this so-called incontinence necessarily. Pelvic floor dysfunction comes in so many shapes and forms. We've done a whole video on that. I've written blogs on so many faces of pelvic floor dysfunction. Incontinence is one of them, and not everyone's story. So you can have weak pelvic floor without having incontinence. That's the whole story. It does contraction for you. What other questions are typically asked?
Do you keep your clothes on, which you obviously have on?
Yes, you don't need to take any. No, nothing comes out of this table, this chair. I'm sitting on it. It actually uses the electromagnetic, kind of like MRI, that technology. That is being used actually right now. We have a company that does neurostimulators, that are testing the machine to see if it impacts their device or not. So, we're glad to be a part of that research and hopefully benefiting other people. Any other questions that are typically asked?
How many times does it take?
Technically and typically in our office, I can tell you about our office, we do about no more than 10 sessions, but our sessions are always followed with the breathing instructions and practices, which we have other devices that we connect to the patient to see the quality of their contraction of their diaphragm. And we follow them with other movement exercises because we feel that that is necessary for people to understand what they need to do. Another thing that we actually do that is, I think it's important for people to realize, is that a lot of times, I would say a high, almost everyone here, with actual part of their dysfunction, part of it was incontinence or having difficulty, different types of incontinence. They have cleared some of them first visit, some of them after 3 or 4 visits, they start noticing like 50-60% improvement. But the issue I have is this machine by itself can only do Kegel. You have to accompany what you're creating with how to move, and that's where I think people need to realize the machine's performance, unlike what the factory and the manufacturer says. They say, well, you know, you need to maintain it every, you know, a couple times a year, or maybe, you know, once every 6 to 10 months. In reality, I think if you do the exercises to hold what you created, you shouldn't get that properly. And that's what we do in our office. We implement other exercises relevant to the dysfunction to empower the patient with the tools necessary to proceed. What other questions? That was a long answer, wasn't it? But it had to be.
I think that covers it.
That covers it. So it's a handful of questions that people have then. Very good. So the session is about 28 minutes. I'm at minute 17.3, so I've got 17 more minutes to do this. So if there's no more questions, we can stop.